Okay, hello again. I just remembered that after 4 o'clock we're expecting the Deputy Chief Justice, the man who's waiting to take over the hot seat of the Chief Justice office, Raymond Zondo, to address the media. We hope to take you live there, but that's coming after 4 o'clock. But for now, we are continuing our discussion around TB in South Africa, today being World TB Day. What are the ways we can to overcome it for good? With me in this discussion, the Chief Director of the National TB Program in the Health Department, Dr. Norbert Ndjeka, the Director of the Rural Health Advocacy Project at Wits University Russell Rensburg. He's with me in the studio. We also have on the line the General Secretary of the Treatment Action Campaign, Anele Yawa, and multi-drug-resistant TB survivor and activist in this field, Dr. Zolelwa Sifumba. Thank you very much for staying with me. As I said, we are just going to be talking until we get that live coverage of the incoming, I'll call him the Chief Justice Raymond Zondo. But let's focus on this matter. Can I just spend a short time talking about the National TB Recovery Plan? Let me start with you in the segment, Dr. Ndjeka, you as the Chief Director of the National TB Program. Before we went to break, Anele was saying, we want more details, we want to know the budget, we want to know how it's going to work so we can support this program on the ground. What are you able to share with us this afternoon about this plan, this program?
Yeah, what I can say about this plan is that there have been extensive consultation at national level. We've engaged our provinces only recently, a few days ago, when we got a consensus with civil society and all stakeholders. Our provinces have indicated to us that they were already planning, doing their plans, because we have to plan. Nobody can be at work without planning. So they are going to adjust their plans very quickly. By month end, we expect them to have their plan aligned with what we are proposing, and then costing is moving with this. Sometimes month end or early April we'll have a good idea in terms of the cost. But I must say, when I spoke to my provincial colleagues, they were not even surprised. They were saying we should have done most of these things a long time ago. They not new. They are doable. We are committing to do it. Okay, when you hear the details next month.
The details will come later. Anele, when you hear that from the Department of Health, from the new Chief Director of the National TB Program, that the money side, the costings are still being worked, they will be shared a bit later. How do you feel?
In terms of what is being said, we welcome. Can you hear me, President?
Yes.
Can you hear me? I'm saying in terms of what is said by Dr. Ndjeka, we welcome it. But we will only appreciate it when we see it being implemented and bearing fruits on the ground. It's only then that we will realize that our government has rolled up the sleeves to ensure that the lives of the people are saved. As it stands now, it is still lip service. Let's see the plans and see how best can we support them on the ground.
It's going to be up to implementation, Russell. It's a very important point.
Look, yeah, you know, in our view, we feel that there is actually significant money to start this process. You know, in our current finance...
Are you saying there's already money?
There's already money. I think this is where the leadership and the accountability comes from. You know, we have over 28 billion rand that's allocated to HIV, TB and outreach services in a grant called the District Health Program Grant. And then we also have funding for TB within the provincial equitable share allocations, which make up 27% of the transfers that are made to provinces. And when we start talking about investing in TB for change, you know, we need to start looking at the things that can deliver the greatest results. And I think here Dr. Ndjeka has some power. You know, there's some conditionalities attached to the conditional grants. In the past, they haven't really been managed well. But working with his provincial counterparts, they can look at the funding within that grants and see, even if we just start the process in the 14 priority districts, we can get the process moving. You know, and I think that's why the focus on targeted universal TB testing is a low-hanging fruit. It's not the only thing that we can do. But linked to that, we also have outreach funding, about 8 billion rand that's allocated for community health workers. They can provide the treatment support that Doctor spoke about earlier, that patients living with XDR TB need, ensure greater linkages to care. So for me, investment is really understanding where can we get the quickest gains, how do we reuse the resources that we have right now, how do we deploy the human resource capacity that we do have to start making a change. And I think when we start increasing the testing and linking more people with care, we build the system's capability. It's not the beginning and the end, but we can begin. Otherwise, when we talk about costing and budgeting, and then we just end up delaying, and the next time we hear there will be 100,000 people that die from TB.
Don't delay the costing process, Dr. Ndjeka. I think that's the message that's coming clear. There could be some low-hanging fruits. There are certain budgetary resources that you might have in your control. And as a chief director for the National TB Program, when you hear that plea of saying do not delay the process, what do you think? Can you fast-track it?
Yes, it has to be fast-tracked. We have, I agree with Russell, we have a lot of money in the system. In addition to what we have in the country, we're getting $139 million US. I repeat, $139 US million to help us in 12 high-burden districts in the country as from 1st of April for the next 3 years. That is more than $1 billion or $2 billion of rand, for those who know these things very well. It's a lot of money for 12 districts. We have to keep one another accountable. Accountability is a two-way process. I like what Comrade Anele is doing, keeping us on our toes. But we shall be also asking questions, because we all have to deal with this. It's a matter of keeping one another accountable and leadership. All these monies we got in the past, what has happened? Moving forward, we should have that kind of conversation, and I'm sure we'll have to tell the people of South Africa what is really happening with the money.
I think asking the hard questions is going to be part of this journey, because I mean TB is the forgotten killer currently because of COVID-19. Going forward, as you said, we can't afford that. Accountability is key. Dr. Sifumba, would you agree?
Yes, I do agree. I do agree very much because, and I want to add accountability. We as the public and we as the people that rely on the health systems, I think we also have a responsibility to hold our leaders and those in charge and making the decisions accountable. So I'm hoping in that accountability, Dr. Ndjeka, you are also including us as members of the community who are also invested in these improvements happening. We as members, we as activists and advocates would also very much like to keep you guys accountable, as long as you can show us how to do so and give us the platforms to do so. But yes, that would be very great. That sounds good.
Now, Russell, from your side, you have spoken about a TB accountability consortium.
Absolutely.
What is that? What does it look like? Who are the people who are participants, who are members of this consortium?
Look, I think there's a lot of different angles as leading researchers in the TB think tank that we're beginning to build and target to be part of that. So we have world-class researchers that can advise the National TB Program on some of the things that we need to take up. We're building a partnership with the TAC Richetse program, which is really about user monitoring. And I think that's a very important part of the link. And, you know, if you look at some of the reports that Anele's organization has put out of the different provincial reports, some of the things that are constraining health system delivery just requires strong localized management. You know, things like staff attitudes, things like staff waiting time, long waiting times within clinics. Not all of those are budget related. Sometimes it's just culture related. And if we push that accountability more, both at that level, and then additionally we have public participation fora, both in our national parliament and in provincial parliaments, that we as activists, advocates, researchers can come together and start pushing for more accountability. The National Department for Health and the Provincial Departments for Health each develop annual performance plans. In those performance plans, they lay out a whole lot of different targets for the year. And every quarter they go to Parliament and they tell them how they're progressing on their targets. Their budgets are informed by those targets. But there's no accountability for them missing the target. You know, so what we are saying now is let's pay a little bit of attention to the things on the ground. If we say we're going to do 100,000 TB tests this quarter, come April and we've only done 50,000, tell us why. and then make us part of the solution and not just the subject of the solution. Because accountability comes at a number of different levels.
What should change in terms of ensuring that there is no lack of political prioritization of the fight, the battle against TB? I mean, we saw this tremendous political prioritization of the battle against the coronavirus pandemic. TB has gone nowhere. The numbers have worsened in the last 2 years at different levels. People accessing facilities. 2 weeks ago, I interviewed the CEO of the Sizwe Hospital, the only hospital in Gauteng that treats drug-resistant patients with drug-resistant TB, and they were saying the numbers declined. Okay, but now, what should change in your view, Dr. Ndjeka, to demonstrate that there is political, at the national level, at the Department of Health, prioritization of the fight against TB?
Yeah, thank you so much for that question. You know, what's happening is that we celebrate World TB Day 24 March, and then after 3 months, everyone is quiet, and you hear again in January the following year or February. You know, we should celebrate the World TB Day 3 times a year. Why not? You know, not celebrate in a big way, but at least what I've seen is that people only have a report towards the 24 March. But we should be having this report in July, in October, 24 July, 24 October, just to say, what have you done? Because the government fiscal year starts 1st of April. And we don't know. Usually we're quiet between April, May, June, July till December, and then we start to talk there. So we should really be talking about this. But those in charge should be asking questions to the NGOs. Government should find out from NGO what's really happening. Civil society should be asking government what is happening. Everyone should be asking questions, you know, so that we know what is happening. In that way, people will feel that, yes, something is happening, so that those who have problems are assisted early. Because many people sit with challenges for years, for months, and they don't get help. They don't even know who to speak to.
Okay. Now, yeah, you want to say something, Russell?
Yeah. Well, I think at the end of the day, it's not us and them. The government is us, and we are the government. And I think part of, we don't need to treat each other as foes. We need to work together because we all have different strengths. And like I said, I think the Richetse program that TAC runs is doing amazing work in making users part of holding facilities to account. And I think the next step for us is now to work together to fix those gaps. We don't want to come every 6 months and report that waiting times are long. We don't want to come every 6 months and say that drugs are not available. We don't want to come every 6 months and say that staff attitudes are terrible. I think in between those plans, we have to now start working together as a collective, much like we did in COVID, in advancing towards those goals. And I think in the short term, part of looking at that national TB recovery plan is agreeing on what are the things we're going to prioritize. It's a very long list of things, and when we have long lists of things, we don't do it. And I think accountability improves when we're all involved.
I wanted to end our discussion today about how do you regain the losses? How, as Dr. Ndjeka said earlier, how do you trace the 150,000 missing? How do we prioritize? So I was going to ask you, just at the end, when we end this, we're going to talk about what are these priorities going forward. And I'm looking at the time because I was told that about 15 minutes past 4, the incoming Chief Justice, Raymond Zondo, is going to be briefing the media. Currently still the Deputy Chief Justice. We need to bring that live. But leading into that, before we talk about the priorities, just you've clarified from a political prioritization thing, Anele has been very clear in his view from a treatment action campaign. But the point remains, the strategies that have been put in place now, going forward, under this recovery plan, will they work? Are you convinced, Dr. Ndjeka, that they would assist? Before we talk priorities, just the overriding strategies that have been put in place as part of the plan, do you believe they will deliver the results of you, for example, recovering the targets that now we are behind on in the fight against TB thanks to the coronavirus pandemic?
Yes, the plan that we put in place should work. I'm confident it will work because it's a consensus. We agree this is what we have to do, and we agree to work together. We agreed that moving forward, regularly between us and SANAC and all stakeholders will be reviewing progress, which we didn't do in the past. So I believe that is something that will help us get results, because we will know what are the challenges, we'll fix them moving forward.
Is the data that's being used in terms of looking at the losses and drafting this plan, is the data, the TB data, reliable?
The TB data is of good quality, but I must say it is not real time. We get to know, for example, people who died late, much later. It's not real time. So those are the challenges that we have, and we want a real time system that will tell us, just like COVID, for example, last week or today or yesterday, how many people died, and then we work on it.
And we can do that. I mean, yeah, and we can do that. Coronavirus pandemic has shown that this country is capable of providing real-time data. We can do that. Okay, we've got less than 5 minutes, I think, and we might need to take a short break before we go to Raymond Zondo. I don't know. I'm waiting to hear from the producer. But whilst we're building up to that, I just want to not lose the moment about priorities. Dr. Sifumba, what should we prioritize? This is a plan. It's there. It's being costed now. There's I don't know how many billions of rand coming in in terms of US dollars, plus the other monies that exist. Dr. Ndjeka said they're busy costing. They're going to fast track it. But what should the priorities, in your view, be?
So, in my view, one of the biggest priorities should be the people that are actually on treatment, the people that are within the system who are on, however many months of treatment, those beginning, those ending. I would like for them to be the focus, how they're supported. I think it's been many, many years that I've been doing advocacy, and I've been coming to find that the conversation will always be sort of around drugs and medication, but the conversation never really goes to the kind of care. And, when I say the kind of care, I mean psychological support. I, throughout my treatment process, was severely depressed and suicidal, and I didn't really have any health workers asking to find out, how I was doing, and suicide is a known side effect of, some of the drugs that some of the people are on. So that's why I'm saying I would like to right now be a voice for all of those people that are on treatment, all of those people that are going to be on treatment, because it's a huge, huge struggle. And it's very difficult to voice those things out to a health system where you can't really complain, about the toxic side effects of the drugs, So I would like there to be a big focus on the lives of the actual people that are suffering, because I like to say it's not enough to put people on treatment. As a doctor, I know that you have to support your patient through treatment. Otherwise, you really haven't done much. So from my side, I would like prioritized the actual people on the ground that will be required. So I'd like some of that money, to go into support systems, social support systems, psychological support systems, because we're going to keep losing the battle against TB if we're not actually ensuring that people are completing treatment. And if we aren't supporting them, then I think there's no reason to expect people to actually continue with such toxic treatment, So we need support. People need support. They can't just do it by themselves, and the health force as well needs to be sensitized to how to treat people that are undergoing treatment. Because as I said, I was very depressed, and I wanted to give up on treatment every single day, and it was only through the help of other TB survivors that I could actually survive. So, yeah, that's what I would really, really like.
Yeah, I saw Dr. Ndjeka making notes. You can't see him, but I saw him there making notes. He's noted this plea that as part of the National TB Recovery Plan going forward, and we need to be supporting the people. There's important that support. From your view, Anele, are you still with us, Anele? I think the connection might not be great. Anele, are you there? Can you hear me?
Yes, I'm still here.
Yeah, your priorities, what should they be?
Can you hear me?
Yes. Did he freeze now?
Okay, there's a challenge there. Apologies for that. Let me come to you, Russell. What should the priorities be? We've heard from Dr. Sifumba.
Look, like I said, I completely understand and appreciate the perspective that Dr. Sifumba brings. You know, and I think it's really sad that the drugs that are meant to heal us also contribute to our ill health. And I think one of the priorities within the National TB Recovery Plan is to strengthen systems for retention. And included in strengthening those systems is providing this kind of community-based psychosocial support to get people through the treatment journey. Right? But I think in the near term, we need to look at the system completely. We need to look at each of these priorities. For us, it's really increase the number of people in treatment, find ways and means that bring that newly initiated people into treatment, having that right kind of support to keep them on treatment so that we can increase success rates. And I think really the political accountability, I think is not good enough just to have the Deputy President as the chair of the SANAC, South African National AIDS Council. We actually need that chair to actually then work with other legislative bodies like the parliaments, like the provincial parliaments, the provincial managements to coalesce around this goal and say, we are going to end TB as a public health threat in the short term.
I see we have a better connection from Anele. I don't want to lose him.
No problem.
So, Russell, you have a better advantage in the studio here. Anele, I see we've got a better connection now. From your perspective, treatment action campaigns perspective, what should the priorities be?
One, I hope that you hear me. One, we support the TB recovery plan. We want time budgeting. But on top of that, what is important is the attitude of mind. We need to change the mindset. Two, each and every day must be treated as a World TB Day. And three, we are the people. When we want to meet with our leaders, it must not take us 6 months to meet with the Deputy President or the Minister of Health or Dr. Ndjeka whenever there are problems on the ground. Lastly, when we as the people on the ground, we continue to speak truth to power, it must not be changed and be viewed or perceived as people who are anti-government. We are not anti-government, but we are using our constitutional rights to speak out and speak truth to power in order for the services on TB, HIV, COVID, and everything can be improved on the ground. We are the people on the ground, and we are here to work with the government. Thank you.
Okay, no, thank you very much there, Anele Yawa. I would like to end it on that note, and thank you very much, Dr. Ndjeka, the Chief Director of the National TB Program in the department, in the National Department of Health. Thank you as well to Anele Yawa, General Secretary of the Treatment Action Campaign, and Dr. Zolelwa Sifumba, a TB survivor and activist. Thank you for your time and your views. And finally, Russell Rensburg, Director of the Rural Health Advocacy Project at Wits. Thank you very much on this World TB Day. Well, we've had the views. Yes, it's doable. It can be done. We've proved it in how this country has been tackling coronavirus pandemic. But we have this killer disease. It's a forgotten killer. But there are priorities. There is a plan in place. We'll track it. We'll talk to these various role players later on in the year.